Hi, I'm Dr. Monacy Ladrigan, board-certified pediatric dermatologist, here to tell you about the 5 things you need to know about infantile hemangiomas. First, there are 2 types of infantile hemangiomas, deep and superficial. Your child may also have a mixed type where there is a superficial and a deep component. They differ in how they present, how long they grow, and what sort of scar they leave behind. Second, most hemangiomas typically follow the same history. They are either absent or barely present at the time of birth. Maybe you might see a pink, gray, or lighter skin patch initially. For superficial hemangiomas, those that appear like bright red plaques on the skin, these hemangiomas start off around 2 to 3 weeks of age as a flat red or pink patch and rapidly get thicker and larger over just a couple of weeks. They usually slow down their growth around 8 to 12 weeks of age. Deeper hemangiomas, those that are colorless bumps, sometimes blue or purple in color, are usually noted a little later and can grow for several months longer. Next, there is no reason to treat the area with extra caution, as it is not a bag of blood that is waiting to explode, but rather a tight collection of small capillaries. If bleeding or scabbing is noted in the active growth phase, this can be a sign of ulceration, a concerning feature that should be addressed by someone who has experience in the treatment of infantile hemangiomas. The fourth thing to keep in mind is that these hemangiomas can sometimes leave a mark behind as the child gets older. When I hear that people have been told that their child's hemangioma is going to go away, I often cringe. This makes you think that the red mark will be replaced by normal skin, but this may not always be the case. The final appearance could be anything from a depressed scar to a pink patch with vessels to a fatty, pouchy mark with extra stretchy skin. I like to compare it to a pregnant belly that goes through rapid growth, but it doesn't always snap back to what it looked like before. Lastly, there are great treatment options to help minimize the appearance of the scar or even make the lesion go away totally in some cases. But these medications and lasers are best used in the active growth phase, sometimes even before you have your 2-month pediatrician visit. There is topical timolol, which comes as a gel, and oral propranolol. The brand name version of this medication, called hemangiol, was safety tested in babies as young as 5 weeks of age. In my opinion, these medications have been a game changer. They are very well tolerated by healthy babies and have few side effects. In my office, I prescribe these medications often and have great comfort with them. For the right patient, using a pulsed-dye laser can also help and can be used alone or in conjunction with the topical or oral medication for the best possible cosmetic outcome. After the fact, if there is a scar noted, a referral to a plastic surgeon can be considered to surgically remove the mark. But remember that this is trading one scar for another. Reaching out to an experienced pediatric dermatologist early to know what your options are is ideal. And those are the 5 things you need to know about infantile hemangiomas.